Welcome back, everybody, to episode 2 of our AA Aesthetics podcast. Thank you so much for listening to the first one. We got loads of good feedback, didn't we?
Yeah, we had really good feedback.
And it obviously is a little bit more difficult than it looks to actually just sit here and have a conversation on camera, especially for Annie, who's not done it before. I've got quite a few years on YouTube, so it's a little easier for me, but it's definitely a lot harder than it looks, isn't it?
Yeah, it can feel really awkward, and I can talk for England.
But then when we put you on camera, you're just quiet.
I know.
But yeah, we really appreciate it. And we've managed to get it on Spotify as well now. So like Annie and myself, we listen to quite a few podcasts, and it's obviously a nice place to do it, just sitting in the car or, you know, when you're just laying down at night. Unfortunately, we won't help you go to sleep because we're probably too annoying to listen to. But you can now listen to just the audio on Spotify rather than actually having to have the video on YouTube as well. So hopefully that's a little bit more accessible for everybody. And we've been kind of talking about what subjects to do, and Annie's got like loads of ideas of subjects, I've got loads of ideas of subjects. But today what we're going to do is we're going to talk about Botox versus fillers, because in our support chat that we've got for our students, we keep getting asked a lot of questions where you should use each one and why. Mm-hmm. So we figured that would be a good subject to start today. If you've got other ideas for subjects, like we said last week, just drop us a message and we'll think about them for the next episodes. We are a little bit quicker, I think, onto this episode than I said we would, because I think we said once a month, didn't we?
Yeah.
But I think it's been what?
It's only been like 2 weeks.
Has it been 2 weeks?
Yeah,
okay,
like 2
so
weeks.
2 weeks. So that's good. So we're going to go through Botox versus fillers. And what I'm going to do is I'm going to get Annie to kind of ask me some questions, and I'll ask Annie some questions based upon the fact that maybe we're like a client.
Yeah,
so
cool.
we don't quite have as much knowledge.
Yeah.
Because these are probably more of the types of questions that you're going to get asked rather than a sort of slightly higher level. So I think we'll start with that, and then at the end we're going to run through. We're not going to definitely not going to gun. We're going to run through some questions that we've had from our students. So just probably some kind of basic-y type questions around fillers, probably more than anything else. And we'll go through that as well. So I think a lot of the questions that come around Botox versus fillers is like, why would you have one and not the other? And where would you have one and not the other? And what is the difference between the results?
Yeah.
So, for example, if you've got like lines here, like in layman's terms, like your 11 lines, or some people call them like frown lines, that are created via your corrugator here and the procerus in the middle, when would you fill the lines? And when would you have Botox to get rid of them is quite a good starting point. So I think there's kind of two different approaches. I think that Botox always gives like a slightly more natural look.
Baby Botox.
Baby Botox even more, because then you're still maintaining some kind of like movement.
Yeah.
But I think when you're looking at like these lines, for example, your frown lines, if you've got like a ridiculously in-depth, deep set of frown lines, relaxing the muscles around it that create those lines might not be enough. Mm-hmm. So in that case, then you may need to potentially have some filler in there just to pop them out a little bit, to give that kind of like cleaner look in the first place. And then on top of that, and you can have at the same time some Botox as well, which will always like lift you up and out, so you're getting like a double effect. So there are situations where maybe you'd even have both.
I don't think a lot of people know that though. I think a lot of people, I don't know many people that would think of having fillers in their forehead. I've had loads of clients say to me that it's Botox at the top and fillers at the bottom. Have you heard people say that?
Yeah, a little bit.
I've heard loads of people say that. Obviously it's not correct, because you can have Botox in loads of areas, but that's like the commonly known phrase.
Yeah, I think as well, I had 2 clients last night, and the lady was about 50, sort of mid-50s, and she said she wanted like some anti-aging. She's kind of really begun to notice that her face is looking older, and she wants some anti-aging. And my first actual response was, yeah, well, we need to put filler here, Botox here, etc., etc. And she was like, oh, filler. Like, but I'm going to look like a fake doll.
Is that what she thought? Over Botox?
Yeah. So I think a lot of people have this really like bad misconception about filler, that just because you have like 1 mil of filler in your body, you're all of a sudden going to look like...
Plastic fantastic.
Yeah.
Yeah.
What's an example of a person that looks kind of extra in the filler
Pete
department?
Burns.
Pete Burns. Yeah, so I think that as soon as I said the word filler, I could see almost like the shock on her face. Like, oh my God, I'm going to look like Pete Burns tomorrow, etc., etc. So I was like, no, we can do very, very subtle enhancements, and actually my personal preference with all filler is natural enhancement rather than over the top enhancement, although obviously if someone wants that they can have it. And in fact we just had a discussion about Nicole, who's my PA, who's just off camera. Say hi, Nicole. Hi. And we said that we've done quite a lot of work on Nicole. We've done what have we done?
We've done chin, nose, lips, and did you do nasos?
We did, yeah.
Nasos.
However,
lip
with nasos, sorry to interrupt. However, with nasos, we didn't put filler all the way down the lines. We just improved like the nasoalar triangle here, which sort of popped her back out, which I think was one of her. Was that your favourite one? Yeah. Yeah. So we've also done Botox in multiple places on Nicole.
Yeah.
Yeah. And we were saying earlier that you would look at Nicole and you would
never.
No.
Think that she's had anything done.
No.
Nothing.
Nicole's only 22, pushing 23 fast, but she literally looks so natural. It's unbelievable. If I can, I'll try and like flash an image up on the screen, although she's going to hate me for saying that. But yeah, so you can do filler in a very, very natural way, as we know, because we do try as hard as we can to keep it as natural as possible.
Yeah, and that is how it's like changed over the last few years as well. Before, there was like a little time where it was the towy duck look. People kind of actually liked that look, and now it's the complete opposite. Everyone wants to look natural. That's the new thing. And that's the better thing, and that's kind of where we work anyway. Yeah,
that's really what we're striving towards. So I think a lot of the point is, when you're talking about Botox versus fillers, is that, first of all, you've got this misconception from people that fillers is going to make them look fake. And in a lot of cases, if you go too far, obviously it can do. Yeah. But actually, you can be ridiculously naturally looking like Nicole. And I've had a lot done. Yeah. So that's kind of like a lot of the sort of misconceptions that people have around the two. But let's talk a little bit more about some of the areas where you can have either both or there's alternatives. Yeah. So a good starting point again is like the 11 lines. So you can have obviously filler if you've got like very, very deep lines that Botox is never going to get you to the point where it fully flushes out that deep wrinkle. It will stretch you out to the point where maybe you're kind of flat and smooth and you've got nice transitions between areas. But I think if you've got like really deep ones like mine, for example.
Yeah, yours are deep.
Thank you. I think that just by pulling it out, you're still going to have the actual line. It won't have like a depth to it, but the line will be there. In which case, filler is going to be perfect because it's going to bring a lot more hydration to the area. It's going to push it out that little bit more, and I think you're going to end up with a kind of cleaner, like smoother transitional look. Yeah, so that's a good example of that. Obviously, as we start to get up into this area, the kind of danger in terms of a filler world sort of starts to increase. But so long as your knowledge is good and your complication knowledge is good, then you're gonna be fine doing it. Another good example actually is what we did on Nicole just recently with her lips. So Nicole has naturally got like a slightly downturned mouth, which gives it this kind of almost like, I don't know, like a sort of handlebar-y, like banana-y type shape.
Yeah, it's like it looks like she's unhappy when she's not.
Yeah, she does have like normally like a bit of a resting face. Yeah. So With Nicole, when I did her lips, on most people actually always give them a bit of an we both do. We give them like that kind of anti-aging sort of upward injection out of the commissure of the lip, and I did that with Nicole, and it made a slight improvement because it just ever so slightly turns up the corners of the mouth, doesn't it? It kind of just gives that slightly fresher look, especially for people who are a little bit older. But with Nicole, where her lips were actually really quite significantly downturned, I thought that it was because her DAO muscle, which is the depressor anguli oris, which is kind of sits in the corners here, it's like a sort of almost like a triangular shaped mouth, which is responsible for that. You can actually feel it. If you do like a really unhappy face, you can feel the muscle here. And I actually just thought that maybe hers was just that little bit too tense or tight. So we did a DAO injection of Botox on Nicole, just a couple of units each side. And I'll actually flash up the image for it. And it's completely raised the corners of her mouth. And now she's got like a straight line mouth, like most people have, rather than this sort of like upside down U shape.
And that has made the world of difference to Nicole's face.
Yeah, it's incredible. Yeah. It's actually worked way better than I have seen it on other people.
Yeah, it looks amazing.
So in a lot of people, you'd use that same injection for removing the marionette lines. So obviously, as we get older, the muscles start to kind of tighten up, and that DAO muscle creates this marionette line here. So in older people, we give them the DAO injections, and there's actually a lot of kind of, not controversy, but there's a lot of debate about where that injection goes. I prefer to stay quite low and quite wide, but then other people come like within a centimetre of the corners of the mouth, so it varies quite a lot as to how you do that, but it worked perfectly with Nicole, and I like to stay low and wide to avoid coming inside, because then you can affect the kind of smile and maybe even speech and eating and drinking. So we keep it quite wide there on the DAO, and yeah, it's made an incredible effect. And I think for people that are older and really starting to develop these marionette lines, that's an incredible treatment. Whereas a lot of people would go straight in with the filler on those lines. Maybe because a lot of people maybe only work the top third of head with the face with the Botox, rather than understanding the lower level. So maybe people tend to go more in with a filler approach here. But I think in that situation, because we've got no filler around Nicole's marionette lines, or out towards the sides of the mouth or anything like that, it's a much more natural look.
Yeah, and for people who do have that fear of filler, it's perfect.
Yeah, absolutely perfect. So that's actually a really good option there, where maybe I would choose Botox over filler. And I think the lady last night, she had quite deep marionette lines. They were almost folding, that they were so deep. So I think with her, I would probably go Botox first, see what we can get rid of, and then anything that's left over, again, we would double up with filler and start cross-hatching down the marionette lines to really finish off the look. So that's another good example of like Botox versus filler. I mean, somewhere where obviously filler really probably wouldn't help is in the frontalis, the forehead, and if you've got like I have and you haven't, these wrinkles up here, like them ones, you wouldn't want to start going in and cracking in loads of filler.
No, not at all.
So that's a situation where probably you would only use Botox, maybe, unless you had like some real significant like deep line. In fact, Robin, who also works for us, she's got a scar, a tiny little scar. You've got like a little one here as well.
Yeah, I've got one.
Hers is a bit bigger than yours, and it's like a little round circle. I can't remember. I think she might have got bitten by a dog. I shouldn't laugh. She got bitten by a dog on her forehead, and it's left like a little scar, and we just put a tiny little bit of filler underneath and just pushed that out.
If you were going to lip flip a client, would you do Botox or would you do filler? That's actually like a personal question to you.
Yeah, that's a really good question. So with a lip flip, you can put a little bit of Botox around the orbicularis oris here, and what that does is it just relaxes that muscle. I just destroyed my speech, which is why we must get this area correct, by the way. It just ever so slightly flips the lip. It just brings it up a few millimetres.
Yeah, you did it on me, didn't you?
Yeah, so if you get a client, for example, going back to the kind of natural versus plastic and people having this kind of concern over filler, if you get a client that is ridiculously adamant that they do not want lip filler, but they could really do with just bringing that top lip up just a small amount, then a lip flip with Botox is an absolutely ideal for them for them. But you're never going to get the look that you get
with filler.
You know, if you want that kind of nice, full, young, fresh lip.
Yeah.
But then there are the cases like you, for example, where you've actually got, in my opinion, what would be like the perfect lip, because I made it.
I was going to say, because you did them.
But we've added in that extra lip flip to give you a bigger lip, but keeping it more natural.
Yeah.
Because if we was to have gone even further on the filler, we might have started to borderline looking very unnatural. So by giving you a kind of fuller lip to the point where you might just about get away with saying that it's natural, although it's very borderline.
It's very borderline.
It's very borderline. You'd be blessed at birth with those lips.
I was anyway.
It just gives you that slightly more natural sort of look, while still making them look kind of bigger, if you like. Plus, you like that kind of just slightly sort of ledge around the top that gives you that sort of powdery look.
The reason I first ever had fillers was when I smiled, I showed so much teeth and so much gum. And that was what made me first get fillers. But at that point, I didn't know that you could get the gummy smile with Botox. And if I knew that, I probably wouldn't have got fillers the first time.
Really?
Because at that point, I wasn't fussed about my lips.
Oh.
It was just the actual gummy smile that I didn't like.
Okay.
So I don't think there's the awareness of Botox with the actual places you can put it and the effects that it has.
Yeah.
Like there is filler.
Yeah, and that's going to be an even bigger problem moving forward because of the advertising restrictions that have been placed on not just non-medics but everybody. You're not allowed to now advertise prescription-only medicine, or POM as they call it, as a treatment. So that's a real problem because there are so many people out there, like you say, that have massive confidence issues because of a gummy smile, for example.
Yeah, I hated mine. Mine was,
And imagine, it's actually quite a bad one as well with the gummy smile because you're preventing yourself from doing a proper smile.
Yeah.
Which is kind of upsetting. So it's really sad that we can't now advertise these treatments because people aren't going to know that there's an option from them out there that's going to enable them to smile.
Yeah.
Like a full, nice, beautiful smile to see that they're happy, which I think is actually quite sad. Which is a real shame about that, unless there is a way around it to be able to advertise that without mentioning certain things. I'm not sure, but it's definitely a lot more complicated.
Yeah, I know you can go along the youthful way, youthful injections.
Yeah, but then youthful injection doesn't work for
anything else.
No.
Yeah, that would only be for
wrinkles. So that's a kind of bit of a problem, really, and it's a real shame that it's had to get to that point. But a lip flip is a fantastic Botox treatment. The only problem with a lip flip is that it doesn't last as long, for example, as like your sort of normal 3-area Botox because of the nature of the strength of the muscle. So you might be looking to get maybe 2 months out of a lip flip, as you know, rather than the kind of 3-4 months that you might get out of the top 3 areas. And that goes the same for gummy smile. But they are fantastic treatments.
Amazing.
Because if you've got someone who's either got fuller lips or is absolutely adamant they do not want filler in their lips, but they do have a gummy smile and they do have a smaller top lip, that's a perfect 2 treatments.
Oh yeah,
for
of
them.
course. And at that point, they're not even venturing into filler.
No.
So they're over the moon, and
Yeah.
they don't have to have any kind of anxiousness going in.
Yeah, of course. And then at the same time, like we said earlier, like Annie, you can have both. So you can be greedy.
Yeah.
You can have both. Which is kind of the ultimate look, really, I think, for a lip.
I needed my lip flip done with Botox, and I needed my gummy smile done.
Yeah,
And
and
that finished
he
it
was
off.
not massively gummy, but although you think you were.
I was really going.
Yeah, a little bit. Whereas now you can see, we just see the ever so tiniest little bit of gum, just as they kind of just begin to come down the teeth. We don't really see like the full gum,
goofy.
the full gum.
Yeah.
So yeah, that's another fantastic place where you can either use one or the other, or double up depending on people's preferences.
Mm-hmm.
And then we've
Why don't you go into like the dangers of Botox? Because a lot of people don't really know about that versus like the dangers of filler.
So
'Cause they're both quite minute, aren't they? But
I mean, obviously, the real danger we always have with filler, although few and far between, but still 100% possible, is obviously the VO, the vascular occlusion, where we're going to potentially block an artery from providing blood supply to a specific area. However, with Botox, you don't have that. So, in essence, Botox is significantly safer at the worst level, if that makes sense. You know, you're never going to, cause someone to have necrosis and then potentially lose a section of their skin and be scarred for life, potentially. However, aesthetically speaking, it's probably worse.
yeah, because of the risks.
Yeah, so with filler, let's say for example Annie said,
You wanted my cheeks done.
yeah, let's say Annie wanted her cheeks done. Annie's, as you can see, has already got perfect cheekbones, but let's say she wanted them done. She nagged me to death, and
Yeah.
I ended up doing it. Let's say she did have it done, and she absolutely hated it. We could just get rid of it.
Yeah.
Very, very quickly and fairly safely. So that really wouldn't be a problem. However, let's say, for example, Annie wanted, like Nicole did, she wanted her a DIO injection here to give her a slightly more upturned look to the corners of the mouth. If we did that and we accidentally got into the wrong muscle
And it dropped.
and you had some kind of weird look to the maybe the center of your mouth, or we affected like the risorius muscle or something that affected your ability to smile and laugh, you're with that for several weeks, minimum. It's going to start to deteriorate after maybe 2 months, but you
That's
could
a long
potentially
time.
have a very odd look that can't be fixed by then trying to oppose that with by putting it in another area, and you're really stuck with that for a minimum really of sort of 6 to 8 weeks before it starts to deteriorate or your shoots start to grow back, and probably up to 3-4 months maybe even.
And that would be the same with like spot brow.
Spot brow we can generally fix, as you know, because we can just add a little bit extra in and it will just relax that back down again. But if you come too close to the orbital rim and you give someone brow ptosis, which is where they start to have a heavy brow, in some cases you can help it a little bit, but really you're stuck with that for a period of time. And even worse, if we come too close around orbicularis oculi here and we start to affect the actual, then we can get eyelid ptosis, where you're walking around with one eyelid almost shut, and you're really stuck with that again for 8, 10, 12, maybe even more weeks.
Yeah.
Which is a bit of a problem.
That's a bit of a problem, isn't it?
So it's very, very important with Botox to absolutely understand your muscular anatomy and your facial muscular anatomy and your dosages, and to really look at someone's
And
muscle.
be precise with your dosages
100%,
as well.
or you're going to end up with some big problems. There's some kind of really easy rules that you can stick to that are going to, in the majority of cases, avoid those problems. I actually know, obviously, a couple of girls that we've taught that have been doing it for a long time now and have done hundreds upon hundreds upon hundreds of treatments, and touch wood, have never had a brow ptosis or a lid ptosis. Although some people say that the statistics for both are quite high, I think that if you stick to some hard, fast, basic kind of safety rules, you can almost avoid it.
Yeah.
To a certain degree. You're obviously, you are going to potentially come across someone whose maybe muscles look stronger than they are, and you put ever so slightly too much in, and they do end up with some kind of ptosis. But or they ignore your aftercare and go straight
Oh,
home and
that's
go to
massive
sleep,
with Botox.
for example.
Yeah, or jump on a sunbed.
Yeah.
Yeah.
So there are some problems that you can maybe not avoid due to customers not listening to your aftercare advice, or just some massive variation in some kind of anatomical variation or something. But generally speaking, yeah, filler can cause, if done either badly, unethically, unsafely, unhygienically, whatever the case may be, or in some cases just unlucky, as a really significant problem. Even that can generally still be fixed if it's not left too long. With Botox, if you're that little bit off, they're with it for a while. So it's kind of odd. It's a bit of an odd one.
Yeah. I don't think there's a winner. I think they both have their negatives and they both have their positives.
I think you'd probably have to say that filler, because of the potential blindness, is probably the way more dangerous, I would say. Because even if you've got like a terrible lid ptosis or brow ptosis,
it's just aesthetics.
It's still just 3 months, which, although obviously, especially in like a young lady's eyes, is going to be horrific.
If my eye was like that for 3 months, I would be devastated.
I mean, it would, once we'd got over the fact that if I did that to you, once we'd got over the fact that
I've left my job, I don't speak to you ever again.
Yeah. I would probably request that you send me daily photos so I could send you some kind of, banter.
Prank.
Yeah. We joke. Kind of. Yeah, I suppose that's how you'd kind of weigh it up, really. But there are so many treatments. A lot of the time, for example, let's say you get someone who's got some jowls. A lot of people's instant approach to that, rightly or wrongly, is to potentially give them a lift and maybe the kind of stretch from some chin and jaw. But in a lot of cases, that jowl is caused by the platysmal bands pulling down too much as we age and actually pulling that jowl down. So there is the potential there as well to give what we call a Nefertiti lift from the Egyptian queen Nefertiti, who had like a really banging jawline. Actually looked well similar to Angelina Jolie, like really similar.
Really?
Yeah, if you Google Nefertiti and you look at the Queen Nefertiti, and this is obviously from ancient times, and then you look at Angelina Jolie, they're very similar looking.
She's unreal.
Yeah, and the Nefertiti look now is very in demand. In fact, like Annie, really, exactly like Annie's.
But mine's natural. Just to say.
Annie's is natural. Everyone looks at you, I think, and thinks, "Wow, he's gone to town on her."
But I know. When we were saying earlier that my lips are my face is quite natural, I wanted to say I haven't actually had facial contouring.
No, we've only done lips.
Only done lips and Botox.
And Botox, yeah, that's it. But you've got the perfect jaw structure, and bone structure. So, like I say, sometimes with jowls, packing in loads and loads of filler and quite a large expenditure may not be the way. No. It actually may be the way to relax those platysmal bands and let that naturally come back to life and lift back up again. So again, that's another kind of situation where you have got the option of both, or maybe even a combination of the two to do there. Again, with the nasolabial lines, we could potentially relax some muscle around here to pull that back out, or we could use it in combination with filler, or we could choose one or the other. So there's quite a few areas in the face where you would potentially choose between the two, and we haven't even really come onto the subject of things like Synechos and Profilo, which just in the essence of what they do could fix some of those minor wrinkles and fine lines without having to start freezing your face or semi-freezing your face with some kind of botulinum toxin treatment. So there's a whole nother area to aesthetics that is not even included in this conversation that you could look at either in addition to or instead of both of those treatments. So there's loads of other stuff as well. Loads. Yeah, that maybe we can talk about that on another episode. But I think we've waffled on for long enough. Hopefully that helps with a few questions that people have got and a few queries around Botox versus fillers. let's go through some of the questions that we either get on the course that are common, maybe more. No, actually, fillers or Botox, and we'll run through some of the questions. So I think one of the common questions we get around fillers is around jawline.
Yeah.
So
jawline's a massive one.
If someone comes in, let's say for example someone comes in and they've got a fuller face than I have around this area especially, is there any reason for them to have jaw fillers?
No, if their face is fuller, you wouldn't really be able to do it.
Because
you wouldn't see the difference.
Okay, yeah. So, and it's...
That's uncomfortable sometimes to have that conversation with someone, and you have to word it in a way where you're not putting them down and you're not telling them that they're too full everywhere else. It's just some people carry extra weight here, and there's no point taking that money off them and saying they're going to have the Angelina Jolie jawline when they're not, because that's unethical. So you might have to say to them, but we could do maybe cheeks if they could have their cheeks done, or we could bring their chin out, and that might then also have a slimming effect on the face. But it's not a one-size-fits-all treatment, jaw, and especially now, jaw is on trend, and that real sharp edge of the jaw is on trend.
I think as well, it's interesting as well, because in some cases, I know earlier we've been talking about Botox versus fillers, and then we had a very quick conversation about adding in things like Profilos and Ecos as well. Your speciality, acrylics, deso, fat dissolving, again is another thing where sometimes you want to double up.
Yeah.
And actually, in the case, let's say for example they are quite full around this area, or underneath the chin especially, it could well be that they go for some acrylics or any kind of fat dissolving treatments for a period of time, and then they come back and maybe you look at doing their jaw later on.
I've done that on multiple clients, but for a lot of people, if they don't understand the background, they do want that quick fix. They do want that. They want to walk in, have a half an hour treatment, like from consultation to finish, and they want to come out looking curved and sharp.
Yeah,
and
which is the beautiful thing about fillers, isn't it?
Yeah.
Because it's instant. Whereas obviously with the fat dissolving, and he's the fat dissolving expert, they got to wait 4 weeks, and then they probably want to have another treatment and another treatment.
Yeah, minimum 2 to 3 sessions.
And during that time, they really want to keep their diet on point, which a lot of people don't want to do. So, yeah, you know, with the jaw, that's a difficult one. We get asked that a lot. And actually, I don't know if you noticed, but when I said it to Annie, she started to speak a little bit quieter when she started to talk about someone having a fuller face, because it's an uncomfortable situation where you, in its rawest form, are telling someone they're too fat to have it done.
Yeah.
It's an uncomfortable conversation, but I think it's much better to put that across to them in some kind of nice way. We use the word fuller face, than take a lot of their money. And let's face it, if you had the fuller face and you wanted any kind of impression on that at all, you're talking about significant amounts of volume and money.
And also, by saying somebody does carry that extra weight, they could be a size 6. They could be a size 6 fitness model, and they could have some extra weight here. So that is why it can potentially be really uncomfortable, because you do get that end, but then you also get the other end of the spectrum where it is somebody who is a larger size and having it done or wanting it done, and you do have to obviously let them know, and that can be uncomfortable, but that does come along with the job. And if it was myself and I was going in for a treatment and someone said to me, I'm really sorry, but you're not eligible for this treatment, I would walk away grateful for not having spent that money, because we are talking about a £400 probably plus,
probably way more,
treatment, if we are having to put that volume in there, because a meal either side is going to make no difference if they are filler.
Yeah.
And then do they really want that? Because you've got to think, the more filler you're putting in,
you're making them more fuller.
You're adding volume, so you don't really want that, especially not for a woman. If we're talking about like gentlemen as well, a lot of the time they do want to be wider, the Johnny Bravo look, but women want to be thinner here, and they don't want it to come out. They want it to be from the sides.
Yeah. So that's a common one, and hopefully that kind of gives some people a little bit of an answer.
I hope people don't think we're rude now.
Yeah. I'll tell you another one. This has actually come up loads recently. I don't know why I've had like a big kind of spate of this recently, and you've got experience of this as well, before I started doing your aesthetics. But I keep getting people who are coming to me and saying that aestheticians are injecting from the inside of the lip. So let's go through some basic rules let's go through like what I would say probably the 3 basic rules of lip augmentation via injection of filler.
For safety.
For safety, yeah. And for aesthetics as well. But let's go through them. So first one, what's the first rule that we always tell everyone on our courses that you do not inject into when you're injecting a lip? The wet, which is
the first one we
on
go
the
through.
inside of the lip.
Yeah.
And we always actually, I don't think you'll see it, but on the courses we always lift up like Annie's lip or the model's lip, and you can physically see on the outside no vascularity, and you lift it up, huge vascularity. In fact, in Annie's case, we can quite literally see
My superior labial
her superior labial artery running through the back of her lip like a Loch Ness monster. It's right there. So we always tell people you stay in the dry area of the lip. The next thing that we tell people is obviously to stay in the pink area of the lip, apart from some advanced injections that we won't cover off today. But we generally say stay in the pink area of the lip. And the final one is
superficial.
Stay superficial. So when I keep getting these people coming to me and saying that people are going from the inside of their lip, which is A, way more difficult to get to and be comfortable actually injecting, and B, what's significantly more dangerous, I simply don't understand it.
Well, when I had my lips first ever done, this wasn't by Adam, the lady who was doing my lips, I don't want to go into too much detail, but she said to me that she was going to go purely inside my lip and inside my mouth. She pulled my lip down like that and was injected in, and she said the reason for that would be less bruising and less pain. But I was young and naive at the time, and I didn't know anything about fillers. Like, I knew nothing about filler safety
It's
or
not
anything
even, it's
like
not even
that.
really about being young and naive though. It's you could be, old and wise and still not know facial anatomy.
Yeah, of course, yeah.
So, I just can't. You can tell by my talking.
I know you're
I
right.
honestly can't comprehend it, because the only thing I could think is, for example, let's say you, for some reason, you wanted to work from the inside of the lip, and you could theoretically bring the needle all the way through the lip, bring it superficial to the anterior area of the lip, and so you could almost see the tip and then inject from there. But why would you put yourself through so much hard work to do that? But they're not doing that. They're actually injecting the back of the lip. And Annie, until we got rid of it, has got these 2 massive strips of filler underneath the inside of her lip where it's just worked its way backwards. But probably because she went intramuscular and it's pushed it. Yeah. It baffles me as to why this is happening, and I really, really would love to speak to someone who does it and try and understand what their reasoning is for doing it. The reasons you just told me are absolutely absurd. So let's hope it's something a little bit more intellectual than that, or a little bit more knowledgeable than that. So that's another one as well. And then we'll finish with one final question. Have you got any that you regularly get asked on the course that you'd like to cover off?
How many mils can you put in a lip at one time? Because they have clients asking for 3 or 4 mils at a time in their lips.
Yeah, so I don't know about you, but my answer to that is I will, in 95% of situations, only do 1 per time, because I don't want to risk compression VO, compression vascular occlusion. And also I want to let them have time to adjust to their new lips as well. However, we did a celebrity recently, and her lips were naturally just large, not necessarily the width or anything like that, but she had a large mouth, which is obviously desirable in a lot of cases. And I could have definitely put 2 mil in there, and it would have looked like 1 mil on anybody else, just due to the fact that it was a large mouth. And I've come across that a few times now, but it is, let's say out of 100, I reckon it can't be more than 3 or 4 people.
Oh yeah.
It can't be.
I don't go unless it is, like you said, that really rare occasion. I wouldn't put more than 1 mil in.
No.
I don't. And that's purely, in my mind, just for safety.
Yeah.
Unless, like you said, it was the lady that we did and her lips were large, but I personally haven't come across somebody on a client basis that has had lips that have the potential to hold that product. But when you do see people that, like some of our students have showed us messages and they have very thin lips, and they've said, can I have 2 meals because I've got a wedding next month and I want to have nice juicy lips. And there would be potentially people that would say yes to that. And just aesthetically, to put that amount of product in at one time, the healing process, the potential lumps, bumps, and then again safety, which is obviously the most important.
Healing process is a good point actually, because I'm not talking about like edema, swelling, bruising, hematoma, all these different things. I'm talking about, if you think about the skin, if you've got, it doesn't matter what size lips you've got, if you start stretching the lip skin, which is already, in my opinion, probably the thinnest skin in the whole face, you're deteriorating the quality of the skin because you're making it thinner, aren't you? Anything you stretch obviously becomes thinner. So I think it's better to do it in stages, allow the skin to readapt, maybe regenerate, regrow, add some new layers, and then go again, and allow the stretch to kind of keep going over a more natural process rather than just wham 2 mil, massively stretched skin, potentially even starting to look see-through because you've stretched it so much. So yeah, that's a very good question actually that we do get asked a lot. We do get that
asked, and that's been more and more and more as well.
Yeah, I actually get people message me all the time and say, "Can I have 1.5 mil?" And you think, how do you know
that you need that?
That you need that based. I mean, what are you basing that on? Is it just something you've seen in a video, or I don't know? But it sometimes worries me that people ask for that, because obviously for us, we're going to say we'll discuss it during a consultation process. But you think there are a lot of people out there that are just going to go, yeah, no problem. And they've never even seen the lip, and they're just going to come there, they're going to crack 1.5 mil in whether they need it or not. So
anything with half
really
a mil, I don't like anyway.
It's odd, yeah. But anyway, I think we'll wrap it up there. I've no idea how long this has been going on for, but I feel like it's
probably been a while.
It's probably enough. So we've probably got, let's say we had 100 people listening to this. I reckon 99 are probably gone.
I was going to say, I've turned off in the last 5 minutes.
Yeah. However, for those of you that did hang on to the end, we really appreciate you listening. We hope you found it useful. On whatever format this is on, please do drop a comment if it's on YouTube or like, or subscribe even. If you're listening to this on some other form where there isn't the ability to do that, drop us a message, give us some feedback. Please do. We're really open to any kind of criticism or positivity, even better. But any kind of, like, what's the word? I've forgotten the word.
Constructive
criticism would be fantastic, because we do want to get better and better as we go along.
I was going to say, any criticism, probably, I don't want to hear that.
Okay, just send any criticism to me and any positivity to Annie, because she can't bear any kind of criticism. But yeah, thank you very much. We really appreciate your time. Hope you enjoyed it. Hope you've learned something. And we will catch you in the next one.
Bye.
See ya.